Hi everyone, welcome back to the channel. In today's video, we are going to explore the anatomy of the tonsils. What are the tonsils? Waldeyer rings. What are the contribution of the Waldeyer rings? The most important anatomical relations of the tonsil, clinical anatomy of the tonsils, and the most common disease conditions associated with the tonsils. So first, what are the tonsils? So tonsils in general are collections of lymphatic tissues within the pharynx, forming collectively a ring called a Waldeyers rings. These Waldeyers rings are formed by four groups of tonsils. So the first one is the pharyngeal tonsils, tubal tonsil, two palatine tonsils, and lastly one lingual tonsils. Here in this picture, we're gonna take an overview of these tonsils and its location in the pharynx. We have this the nasopharynx, we have here is the oropharynx. So in the back of this nasopharynx, we have the pharyngeal tonsils. The other name is the nasal tonsils or the adenoids. The other one that are located on each side around the opening of the eustachian tube is called the tubal tonsils. They are pairs of tonsils. The other and the most important one of all this group is the palatine tonsils on either side of the oropharynx. Just you gonna see it when you ask patient to open his mouth. Just here, ask patient to open the mouth and say, this is the palatine tonsils, which is the most important contribution in these Waldeyers rings. The last one is the lingual tonsil that are located at the posterior back of the tongue. Okay. So, as I said, the most important is here is the palatine tonsil. So what is the palatine tonsil and what is the important clinical anatomical point related to the palatine tonsil? So the palatine tonsil, as I mentioned before, is the largest member of all other tonsils that contribute to the Waldeyers ring. And as I said before, it's a specialized subepithelial lymphoid tissue that are located in the tonsillar fossa on either side of the oropharynx. So here is the oropharynx, either side of the oropharynx. Here is the pocket-like structures which is contain these almond-shaped structures. The palatine tonsil, this is called the tonsillar fossa. It's just pocket-like structure. The importance of this tonsillar fossa is that it just, as I said, it's pocket-like structure and it's bounded anteriorly and posteriorly by important folds that have a role during the tonsillectomy operations. Okay. Here is the anterior fold, and this is one is the posterior fold, and in between is the tonsil. The anterior one is called anterior tonsillar fold or pillar. The posterior one is the posterior tonsillar fold or pillar. The thing that you have to know is that what structure that forming these tonsillar pillar. So the anterior tonsillar pillar formed by palatoglossal fold, and the posterior tonsillar pillar formed by the palatopharyngeal fold. So again here, palatoglossus and palatopharyngeus fold. Okay. Another important anatomical relations our structure of the tonsils, of the palatine tonsil, is what is forming the medial and the lateral surface of the tonsil. If we're gonna take just a diagram of the tonsil, here is the tonsil. We have medial surface and we have the lateral surface. So the medial surface of the tonsil is formed by invagination-like structures. We called it as a crypt. We have about 15 up to 20 crypts on the medial surface. The largest one of them is this one called crypta magna. The importance of these crypts are they contain specialized type of lymphocyte and they play a role in the immunological function of the tonsil. The lateral surface of the tonsil here is called a tonsillar capsule. This tonsil capsule formed by a condensation of the fascia called pharyngeo-basilar fascia. Another important thing to be mentioned is the tonsillar bed. What is the tonsillar bed? What is the important anatomical information related to this tonsillar bed? So the tonsillar bed, as it appears here, this is the tonsil, and this is the medial surface of the tonsil. This is the lateral surface of the tonsil. As I said, the lateral surface of the tonsil is called the tonsillar capsule, and this tonsillar capsule, as I mentioned, is formed by the condensation of the fascia called the pharyngeo-basilar fascia. Just lateral to this fascia, we have this muscle called the superior constrictor muscle, forming the superior part, and the inferior part not appear at this diagram is formed by the palatopharyngeal muscle. Just lateral to this muscle, another fascia is called the buccopharyngeal fascia. The most two lateral structure are muscle. This is muscle is called styloglossus muscle, and this small nerve is the ninth cranial nerve or the glossopharyngeal nerve. So what is important of this tonsillar bed? This tonsillar bed, as I said, in the tonsillectomy operation, we gonna dissect the tonsil from the bed of the tonsil, which is formed by this structure, and trying to dissect the tonsillar capsule from the pharyngeo-basilar fascia and try to avoid deepening more or diving deep in the tonsillar bed, as if you deep more, there is a risk of damaging this structure, in addition to injuring this vein, which is the main contributor of the venous draining of the tonsil, as we're gonna discuss it later, called the peritonsillar vein or the paratonsillar vein, which is located in the loose areolar connective tissues just between the lateral surface of the tonsil and the tonsillar capsule. Okay, so here it is about the blood supply of the tonsil. So the blood supply of the tonsil is from the branches of the external carotid arteries. We're gonna take a quick overview of the external carotid artery, which is the main blood supply of the head and neck region. So here the external carotid artery, as it ascends in the head and neck region, this is the main branches of the external carotid artery. This is the lingual artery. This is the facial artery. From the behind, we have the ascending pharyngeal artery, and here we have this is the maxillary artery. Here it's continuing to forming the superficial temporal artery, which is the last branch of the external carotid artery. So from the branches of this external carotid artery gives blood supply to the tonsil. So we have from the lingual artery, we have the dorsal lingual artery. From the facial artery, we have two branches contributing to the blood supply of the tonsil, the tonsillar branch of the facial artery and the ascending palatine branches of the tonsillar artery. From the ascending pharyngeal artery, we have also a branch called a tonsillar artery, branches of the ascending pharyngeal artery, and the last blood supply is called the descending palatine artery, branches from the maxillary artery, branches from the external carotid artery. So in brief, we have 5 blood supplies or 5 branches to forming the blood supply of the tonsils. The most important and the from anatomical point and clinically is the tonsillar branches of the facial artery, which is the most commonly causing of the post-tonsillectomy bleeding. Okay, other, as we said, the ascending palatine artery, branches of the facial artery, dorsal lingual branch of the lingual artery, greater or descending palatine artery, branches of the maxillary artery, and the lastly one is the tonsillar branches of the ascending pharyngeal artery. Okay. The last important thing about the anatomy is what is the venous draining and what is the lymphatics of the palatine tonsil. So here, as it appears here in these pictures, as I said before, the venous draining of the tonsil from this vein just slide on the lateral surface of the tonsil in the loose areolar connective tissue, and it's ultimately drained to internal jugular vein called paratonsillar vein. Okay. Regarding the lymphatic draining of the tonsil mainly to the jugulo-digastric lymph node, which is one of the group of the upper deep cervical lymph node. If we're gonna just take overview of it, okay, here is the neck, here a muscle called sternocleidomastoid, here is the jaw. It's just located at this side called jugulo-digastric lymph node, what is a part of the upper deep cervical lymph nodes. Last thing to be discussed today is the common disease conditions associated of the tonsils. So the first one is the tonsillitis, inflammation of the tonsil, pretonsillar abscess, which called it quinsy, the tonsillolith or the tonsillar stone, foreign body impaction in the tonsil, which the tonsil forming common site for foreign body impaction, and the last one is the tonsillar enlargement. Okay. Okay. So okay. So in the next videos, we're gonna discuss the diseases associated with the tonsils and how to manage each condition in separate. Thank you for watching, and if you have